and make your comments.
Yeah, thank you, Chair. Allow me first to apologize for coming in a bit late. My name is Duncan Mathenge, Member of Parliament, Nyeri Town Constituency. By profession, I'm a trained and practicing dental technologist. Since joining Parliament, I have decided to graduate into health leadership, and I hold a BSc in health system strengthening from KEMU. Chair, I want first to pick on the mandate of this task force and just pose a question. Are you prepared, Dr. Kamarogo, and we know your reputation, to look beyond the TOR, to be able to respond to issues, emerging issues beyond the TOR? Having said that,
I don't want you to answer. Yes, that's part of his comments.
Yeah. Having said that, I want also to restate a few facts that you'll be aware of. First is our Constitution and the reality of devolution, and the relationship that are supposed to exist between, how relationships between the national and county governments are supposed to be managed through the intergovernmental relations mechanisms. But also the fact that the counties, under the County Government Act, having devolved health services, then have a county public service board. And the fact that counties have the power to make laws, including budgets where salaries for health workers are going to be contained at the county level. Secondly, there is the voice of the health personnel, but there is also the voice of the recipients of health services. Where do the two come together? As a country, we have been grappling with this desire, and I'm calling it a desire with a lot of reservation, about capping our wage bill. But what are we saying when we come to the health services, to the very many health personnel at all levels that we are training and graduating? The question of unemployment, and as long as I am unemployed and have the skills, whether trained or acquired, to remove a tooth, I will remove it in the village called Nyarugumu, because KMPDC has no way of ever finding me in Nyarugumu. They don't even know. Even if they Google Nyarugumu, they may not be able to get there. Don't introduce Wamunyoro in hell. The other issue is the question of promotions for those who are already in service. Should healthcare providers be made to wait until there is a decision at the global level or at the national level for, I don't know, they are called common cadre promotions, or the number of people who have served for a number of years? And then there is a question of performance. And on performance, Dr. Ogo, allow me to provoke this. We have specialists who are full-time employees in the public service. And they will come to the clinic at KNH. 250 patients have been booked. They will see the first 10 at most, then leave. Is that fair to our people? When we compare the output of those specialists at Kenyatta National Hospital, at PGH Nyeri, and when they go across the road to Nelson Awori, to Upper Hill Medical Center, I can name all of them, and to Nyeri, when they go across the road to Outspan and Madari Mission Hospital and Tomotomo, how does their output compare? As medical practitioners, it is time that we really did evaluate this. and then decide whether the way these specialists are contracted to handle clinics at Aga Khan or at Nairobi or at MP Shah, whether that is something to import into the public service for specialists. The other issue for me is the question of health leadership. And really, we have struggled by trying to belabor the point about Dr. Amor. It is not about Dr. Amor or the DG. It is the lack of a deliberate and clear policy in developing health leaders, which is one of the pillars of health system strengthening. And with strong leadership, then the issue of human resources for health and the key factor of budget and financing. And I dare ask, so if the magic bullet is the Health Service Commission, why have teachers been on strike more times than any other cadre or profession in this country, yet Teacher Service Commission is one of the oldest commissions? And therefore we need to ask ourselves whether we should really be boxed into a Health Services Commission, or all we need to do is to put together the structure and the resources required to make our sector work. Internship. Is internship a health industry gold standard that everybody, including the plaster technician, must do internship, or including the medical records guy?
I would want to give you guidance. You know, there are many of those other issues have been spoken by some other members. So I would want you to just limit yourself to, maybe you do not have the knowledge of what members spoke before you arrived.
All right.
You might be going through back to some of the issues that have already been spoken into.
On internship, Chair, I just wanted to ask, why don't diploma nurses undergo internship while other diploma holders are going through internship? How has it been resolved? And is it time we moved in that direction? Chair, on the regulatory bodies, does every cadre need to have a regulatory act and a body? I am proposing that we can have about 5 regulatory bodies: medical, dentistry, nursing, pharmacy, diagnostics, and rehabilitative. Those broad categories almost regulate the entire health sector. Chair, the question of digitization in 2 levels. The kind of interruption that AI and the Internet of Things has caused, the proliferation of online digital trainings, and whether that online training on Zoom and all the other platforms does confer on me the requisite competencies and skills to go out in the field and start doing orthodontics in dentistry. What is the depth of that training and how? It is a reality, but then how do we ensure that we attain the correct standards from these trainings? Then there's the issue of leakages within the healthcare system, perpetrated by healthcare workers. It is something we have all avoided to address. I hope this task force does pick that up. The issue of degrees has been raised. This country has a problem because apparently now, for you even to be appointed to a board, you need to have a degree. Do all diploma graduates need to have degrees? And would higher national diplomas and other qualifications be equitable so that then we do not all have to want to have a degree in community oral health versus a degree in dentistry. And the scope of practice is so divergent, but because I have a degree and the dentist has a degree, then I feel we can venture into the same area. Lastly, Chair, CBC and the career path to medical services. The guy who will end up as an orthopedic technologist, what should he have? Should he be more of an artist than a mainstream?
Should be a carpenter.
That's what I'm asking, Chair. And therefore, this is another area where the medical profession is going to lag behind unless we pick it up at this level so that we can be able to guide the career path. Because CBC has been developed by educationists. They never really hooked it correctly to the different professions. Thank you, Chair.
Thank you, Honorable Mathenge. I now want to come to Dr.